There we go. Just sorry, there's just a little delay when we switch these slides. So I'll just wait for our slide deck to catch up with us here. Maybe. There it goes. All right, so University of Utah health plans. I think some things that give us a competitive advantage. We definitely have that track record of success and a partner you can trust. Again, like I mentioned, we've been in this industry for 20 years now, and we've just continued to grow in this industry, and we're really, really excited for the opportunities that lay ahead for us. We want to be in this industry or this area long term where other carriers are leaving. We hope that you can see that we're going to be a partner you and your clients can trust to be here for the long term. Leaders in innovation and cost control. We have a lot of unique, innovative things that we do as a health plan to really help control cost. One thing that we do is we partner with our College of Nursing, to go ahead and we do HRA, or health risk assessments, on all our new individual plan members. So then with those health risk assessments, we can go ahead and figure out, which members might have certain triggers that would require us to care manage and really make sure we can control the cost for those members. And again, we're using our own internal college and nurses to do those HRAs. So we're not, using a third party to do those. Unparalleled care and access. Definitely the University of Utah hospital, our clinics, our providers. We've been #1 in quality and care over the last year, and in the top 10 over the last 8 years for academic hospital facilities. So we definitely have unparalleled care. But the access, one thing that we want to make sure we relay to our brokers and that you relay on to your clients is it's our network is definitely not just the University of Utah. They absolutely have access to a very large provider network and hospital network outside of just the U. And lastly, world-class customer service. One thing that I really appreciate as far as working for the University of Utah is that we are local and our customer service is local. They're here in the Salt Lake Valley, in Murray, right across from the Fashion Place Mall. I'm in the same office as our customer service team, and I think there's something to be said about local and your clients feeling like they're calling and speaking with somebody that understands the dynamics of the Utah provider network and the IHC versus non-IHC provider network. And they're not calling to a different state or a different country to get customer service. We're all here locally, working together. So also, there's something to be said about, the ability for me to just walk up a flight of stairs and be face to face with a customer service manager or a care manager so that we can better serve you as brokers as well as your clients. So we'll go ahead and we'll switch over to that next slide. Let me just give it a brief moment to catch up again. All right, so for 2018, we definitely, like I mentioned before, want to expand our footprint and grow to that 50,000 member goal. So we will be offering our plans statewide now. That's in all 29 counties in Utah. Our network will be closer than a lot of you probably think. Your clients will definitely have access to UofU Health, Primary Children's, Mountain Star, and the IHC rural hospitals. That's going to include over 8,700 providers statewide. We're also going to be offering pretty much the same portfolio of plans, metallic level plans that we did offer in 2017 into 2018. So we'll have a gold copay. That plan can be purchased both on or off the exchange. A silver copay plan that again will be purchased on or off the exchange. We've got a silver copay off exchange only plan, and based off of the title of that plan, obviously you can see that plan will just be purchased off the exchange only. And then we've got two bronze plans there. We've got a bronze 3 copay before deductible plan, which again purchased on or off exchange, as well as a bronze HSA qualified plan, which also can be purchased on or off the exchange. Over on the right-hand side of your screen, you'll see our contact information there. So our uhealthplan.utah.edu website, if you go out to the individual and family plans page, we do have our 2018 plan materials available out there, as well as updated network searching. And we also have opened up our 2018 rates window shopping as well on our website. You should all now have access to a broker portal, which I'm going to talk about later in the presentation, and you can now do some window shopping with our 2018 plans and rates. You won't necessarily be able to send those quotes right now, but at least you can get a good feel for what those 2018 rates are going to be looking like. So you can always call us at our broker sales support number. That's 587-2875, 801 area code there, or email us at broker.support@hsc.utah.edu. And then there's my direct contact information as well. Again, Tracy Smith, broker account executive, 801-587-2937. And then my email address is just my first dot last name at the hsc.utah.edu. And just make sure you're sending that to Tracy with an IE. We do have a couple other Tracys in the office, and so just want to make sure you get that to me directly. So we'll go ahead and let's talk more about the network. We are going to be offering two networks for 2018. So currently for 2017, in the 16 counties we're servicing, everyone's on what's called Healthy Premier, and that is a statewide network. It includes 36 hospitals, 8,750 plus providers. So that statewide network is going to include your UofU Health, your Mountain Star Healthcare, and many other local award-winning hospitals and providers, like I mentioned on a previous screen, IHC rural hospitals, Primary Children's, all those facilities are in that statewide Healthy Premier network. For Healthy Preferred, this is a Wasatch Front network. This network will be sold to individuals that live in Salt Lake, Utah, and Davis County. So even though it's a Wasatch Front network, meaning it works from Brigham City down to Payson, we're actually only selling it in 3 counties. So again, those 3 counties are Salt Lake, Salt Lake, Davis, and Utah County. So if you have an individual that lives in any of those 3 counties and they go ahead and they're on the marketplace, or you're running them a quote through our broker portal and you put in one of those zip codes, they're going to see the Healthy Preferred, silver copay or gold copay. They won't see the Healthy Premier network. They will just see the Healthy Preferred network. But again, it's still a very, very large network. It includes 14 hospitals, 6,000 providers along the Wasatch Front, Primary Children's, Mountain Star. Those facilities are in our network, as well as, again, a very large provider-based network of large clinics and other freestanding physician clinics. So some questions that have come up as far as I have someone on Healthy Preferred. They live in Salt Lake County, but they visit Moab or St. George regularly for, camping or vacation. If one of our healthy preferred individuals does go into one of those counties outside of the Wasatch Front, so below Payson there, and they do have an emergency, we are going to go ahead and we'll treat them like they were in network as far as paying those emergency claims in network. However, some of those facilities, because of some provider contracting, they do not accept the healthy preferred rates right now. So there is the potential there that someone in an emergency at Dixie Regional could be balance billed by the facility. We are working with our provider relations team to try to update some contracts there that can help wrap around that preferred network in emergencies outside of the Wasatch Front. But those negotiations are still ongoing. And so as it stands today, if you do have somebody traveling outside of the Wasatch Front on that preferred network and have an emergency, we're going to go ahead and cover them, but there's the potential of a balance bill there. Now, for preferred or premier outside of the state, when it comes to emergency, we actually have a little bit better option there. We can flip on what's called multi-plan national network and wrap those individuals with that national network. So if they are out of state and they have an emergency and use a participating multi-plan facility, we can accept those contractual agreements, pay those claims in network, and then the member would not be balance billed. So there is actually a really good benefit for them when they're traveling if they do use one of those multi-plan hospitals in an emergency situation. I'm sure you'll probably have a lot of questions on this network slide. So definitely, again, like I said, after I finish with the slide deck, we can open up the questions and definitely answer any of those additional network questions you might have. So for the 2018 individual plans, I typically do this this presentation in person. So I have a full highlights brochure where on the screen right now you're just seeing kind of a screenshot of the top half of the highlights brochure. But like I mentioned, if you do go out to our website, we do have our 2018 plan information out there, so you can find the entire list of benefits for 2018 out on our website. Later this afternoon, we're going to be sending out a broker communication, hopefully too, with links again to where you can find all this 2018 individual plans information and some other information that will help you as brokers as we're entering into open enrollment starting November 1st. So like I mentioned earlier in a previous slide, we didn't change a lot from our 2017 to 2018 plans. We did add that silver copay off exchange plan, but as far as anyone that has current members with us, if they do decide to continue with us in their off exchange, we're going to just go ahead and crosswalk them to their alike metallic level plan. They shouldn't see any huge disruption in benefits. Of course, you may see some deductibles, out of pockets, copays possibly go up slightly, but they're really, really similar to what the 2017 benefits were. The bronze HSA plan, I think the question I get most of all on that HSA plan is that $6,650 deductible embedded? It is. So if you have a family of 4 on that bronze HSA plan and just one person gets sick, they would only need to meet that individual deductible of $6,650, and then your remaining 3 family members can then continue to contribute to that $13,300 family deductible. But that goes across the board on all of our plans. We will never over apply that individual deductible. I think as far as Anything else? The plans themselves are really, really standard. We try to keep it simple for both yourselves and the consumers. We don't want to overload you with too many plan options where there's just very small variations. So I like to keep it simple for you. Um, and like I said, to see that full list of all the plan details, you'll just want to go out to our website. So for the next slide, we did talk a little bit about emergency care outside of the Healthy Preferred or Healthy Premier network when you're traveling. One additional benefit for our members that we're very, very excited to announce is our virtual visits benefit now is covered at 100%, no cost to the member on all our plans in 2018. With the exclusion of the HSA plan, there's some different regulations on how that plan needs to be administered by the IRS. And so that plan, we can't pay for those virtual visits upfront at 100%, but we will only charge, or the provider, I should say, the provider claim is only $49, and that would go towards their deductible. But on all our other plans, our silver copay plans, gold copay, bronze with 3 copay, those virtual visits are covered upfront at 100%, and they are unlimited. So what your member would end up doing is they would call a number that is actually listed. It will be listed on their ID card. That will initiate the virtual visit, so they'll be sent a link. When they click on that link, they will then be essentially Skyping with a University of Utah doctor. So we don't third-party outsource this benefit. It is a University of Utah doctor, which is helpful if follow-up care is needed, because we do have record of that, and it is in their charts if they do continue to see a UofU provider. So virtual visits, great for those minor conditions, common conditions like allergies, cough, cold, flu, eye infections, skin conditions, minor burns. Those providers can prescribe prescriptions through virtual visits. So that also is really, really helpful. It's not a 24-hour, it is a 9 a.m. to 9 p.m. 7-day-a-week service for our members. There are some member discounts that we do offer to our members through our Moran Eye Centers. They can get optical care discounts, and then our South Jordan Health Center does offer some additional discounts to alternative care and self-care for our members. An additional member benefit our members have access to is what's called Access Assistance. This basically is a line that's managed by our in-house care manager nursing staff. They can help our members transition or schedule in-network appointments. And where this is really, really helpful is sometimes I know with you providers, it can get tricky to get into some of our specialty care. We can see individuals try to schedule an appointment and be 2, 3, 4 months out on getting into a specialist. What this Access Assistance helps them with is our nurses, our on-staff nurses, can go ahead and assess the situation, and if they determine that our member needs an appointment sooner than what they're getting, our members and our nurses basically have preferential treatment to go ahead and schedule that appointment sooner than what somebody could do on their own. And then lastly, we have our nurse line. That is a 24-hour resource line. Again, none of these benefits are actually done by third parties. We do these all in-house with our own doctors and nurses. So our nurse line is a University of Utah Health Plans nurse that we do have on staff. They answer that nurse line 24 hours a day, 7 days a week. So they can definitely answer some, health related questions and provide resources for our members. Finally, we have a mobile ID card app. This gives our members access to their ID card before maybe they receive it in the mail. Um, if they have a smartphone, they can search for the UofU Health Plans ID card app on either the App Store or the Google Play Store. And then you as a broker with our new broker portal will have instant access to their identification numbers. So if they're needing services prior to receiving their ID card, you can log into your broker portal, find their ID number, give that to them. They can download this app. They go ahead and they enter the ID number, and then the PIN number is just the last 4 digits of their ID number again, and it will bring up a copy of their ID card on their phone. They can fax it, email it, even just, show that to the provider or the pharmacy so that they can access those benefits a little bit sooner. One thing to note, though, as you're pulling these ID numbers out of your new broker portal, the ID card will only be available for those that have effectuated their coverage, meaning they've paid their binding premium payment. So if there's an ID number in there, but they haven't paid their premium, it will not pull up the actual copy of the card. Once they pay their premium, then they will have access to that ID card to use at the pharmacy or at the provider's office. Which this next slide actually brings me to our broker portal, which I think for me at least is probably the most exciting news. It's taken us a couple years to get this up and running. We had a portal for 2017 that kind of just helped with those off-exchange enrollments and it allowed you the ability to quote and email quotes to your clients. But now our 2018 broker portal, it's a completely new system. All of you by now, if you are appointed with University of Utah Health Plans, should have received an email from myself or through broker support with the login information. It was sent, the most recent email was sent out on October 10th. It gave you the directions of where to access the link to log into the broker portal, as well as your username and password. So your initial login, your username was your first and last name, and then your password was your Utah State Insurance License number. And then once you entered that initially, it would have you reset your password to whatever you wanted it to be. And once you're in the portal, there's a lot of enhancements now that you have access to. So you have access to your entire book of business. You can see your on-exchange members, your off-exchange members. If you currently have any members with us, they would be loaded in there now. And here in the next week, they'll start popping up due for renewal. So you'll be able to do your off-exchange renewals through the portal. You can run them a new quote if you want to move them, from a gold to a silver plan, or maybe they've been on exchange and you'd rather have them off exchange. There's definitely some things you can do here as far as renewing your clients. You'll have the ability to run quotes, email quotes. Your clients can then, you can pre-select up to 4 plans, and then they can review those, and when they're ready, apply for one of those plans right through your quote. It'll tie you as the broker to that application, and then you'll see that application through all the stages of the process in your portal. You're also going to be able to create your personal quote button. So that's going to be under your tools drop down. You can create that personal quote button. That quote button is, or that link that it provides you is the link that you want to embed in your Quote-it account, or if you use any of the other quoting vendors that require you to insert your carrier link, that's how you get that carrier link. You also can use that hyperlink link and give it to a web developer. If you have your own website, you can build that into the front page of your website, and something like, I enroll in a UofU health plans policy, click here, quote now, something like that. And then all of those enrollments would be tied back to you through your personal link. When you get into the portal and you go under your individual section, you can click on your members. Once you have your members pulled in, on the left-hand side, you're going to have a bunch of different ways you can filter your members. So you're going to be able to filter, the on or the off exchange. As we get into the 2018 plan year, you can go in and run a report every day, every week, every month for individuals in grace periods. So if you want to follow up and just make sure they're paying their premium so that they don't get canceled, you can run that report out of here. You can see, during open enrollment, you're going to be able to see your pending effectuation. So that's your applications that are in the system, but the members haven't made their binding premium payments yet. So then you can, run that report and follow up with those clients if you need to remind them that they need to make that binding premium payment before January 1st. A lot of really neat benefits, again, that you're going to have access to through the broker portal. We're really hoping that this portal gives you the ability to, be able to service your clients, and as much as we love talking to you, save you that step in trying to call us and find out that information. We're hoping everything now is at your fingertips through this broker portal. You're going to be able to add life events through this portal, add a dependent, cancel a dependent if you need to. So there's a lot of different abilities that you weren't able to do previously that you can now do for your clients through this portal. And that's actually my last slide for the presentation. So I'm sure you have lots of questions. So I'm going to go ahead and we'll open it up to questions. I've got somebody running my controls here. So if you want to type those questions in the chat box, then, or actually just maybe your name, sorry, in the chat box, then we can go ahead and unmute you and you can ask your question. So we'll just kind of wait and okay, it looks like we've gone ahead and just unmuted all of you. So John, will you be quoting shop plans as well? So we are in the large group 50 plus market, 100 plus self-funded, but we are not in the community rated small group market. So no, we won't have those small group plans available. And you guys are actually, I believe, unmuted now. So if you want to just ask your questions, it looks like there's only 8 of you out there. So I don't think we'll all be talking over each other. up. Sounds like we might be having some technical difficulties. I don't know if you guys can hear each other, but I definitely can't hear anyone. So I apologize if you're asking questions and I'm not answering because I can't hear it. So I've got another message from John. Does UofU have a call center? Um, so we do have, and I don't necessarily know what kind of call center you're talking about. We do have an internal call center that will be helping facilitate and answer some of those non-brokered individual member calls. And also, if you have questions about your U of U appointment or need to know if you are appointed, if you want to enter your name in the chat, I've got Darcy here with Stonehill, and she'll go ahead and write down your names and follow up with you to determine if you are appointed with U of U health plans. And if you're not, we'll go ahead and get you appointed. For product and brochures, we will have some delivered here to Stonehill in the next week. Again, all of the information is out on the website, but I know some people do like a few hard copy brochures and highlight benefit inserts to be able to sit down with their members. So we definitely will be delivering those here to Stonehill as well.
Is there really?
So for any other, so John, I see your question about the broker list in the call center. You'll want to just contact Stonehill, your general agency, for that information. I think so. I think that's going to cover the questions. Feel free to reach out to Darcy here at Stonehill, our broker support line. Myself directly, and we're definitely happy to answer any additional benefit, network, appointment questions that you might need. So thank you so much for attending, and we will hopefully talk to you all soon. Thank you.